Hello, we've been talking to some medical professionals about DIY abortions, also known as home abortions or telephone abortions. Now, these were brought in as a temporary measure in response to the COVID lockdown, but there's a possibility of these becoming permanent. Hence the fact that the government is having a consultation on this and the general public is being asked to respond by the 26th of February. So today we're going to talk to another medical professional, Dr Dermot Kearney. Now, Dr Dermot is a consultant cardiologist and he comes from Newcastle, and he's also the president of the CMA, the Catholic Medical Association. So thank you for joining us today, Dermot.
Thank you, Isabel.
So yes, as I said, we wanted to talk a little bit about DIY abortions. Now, I know you've been involved with the abortion reversal pill, which is a way of possibly reversing the effects of a medical abortion. So I wondered if you could just talk us through how the abortion reversal pill works, and then we'll look at how it connects to DIY abortions.
Okay, sure. As you know, the majority of abortions in the UK nowadays, for the last few years, placed by chemical means, by pharmacological means, where the mother takes an initial drug called mifepristone, and then 1 or 2 days later takes misoprostol. Mifepristone is the one that potentially can be reversed. It works by blocking the action of progesterone. Now, progesterone is a natural hormone that is essential to maintain a pregnancy. That's why it's called progesterone, progestation. And mifepristone binds to the progesterone receptor, so blocking the effect of natural progesterone. So it has been found that if high dose of progesterone is given promptly, so quickly enough, it can, not in all cases, I'm afraid, but in the majority of cases, well over 50%, if given promptly, can undo or prevent the devastating effect of mifepristone, and thereby can preserve the pregnancy and save the baby. In some cases, the key thing is to try and administer high-dose progesterone to the woman who has requested help as soon as possible. It's also important to know that the slightly later stages of gestation of pregnancy, there's a better chance of successful outcome. So at 4 or 5 weeks, the chances are much less, much lower than it would be at 8, 9, 10 weeks, for example. But we've been doing this in the UK for since the end of April 2020, so 8 months, 8, 9 months. We've seen about 100 women have come looking for this help. Because that's the reason we set it up, is this is purely in response to a cry for help from women who have taken mifepristone, realize that they've done something that they shouldn't have done, that they regret, and they come looking for help. Very few people know about the service, and it's important to realize that, because this is a service that is largely unknown, and yet we've had approximately 100 cases, 100 women looking for help in the space in less than 8 months or so. Whereas if it was known, then we expect we probably would have a lot more calls for help. Initially, when we set up the service, we were following largely the example from the United States, where they've been doing it in a very organized fashion since 2012. So they've got 8 years of experience. They've had over 2,000 babies saved, so live births after mifepristone. So we know that this can work, not in all cases, but in somewhere between 50 to 70% of cases, depending on how quickly we can give the progesterone and what stage of pregnancy that the mother is at when she seeks help.
So just for the benefit of people who maybe haven't heard of the abortion pill reversal before, is there any risk to the mother's health with taking this?
No, there isn't, and that's very important. And anytime I counsel any of the girls who approach us, that's one of the things that if they haven't asked it themselves, I make sure I tell them that before we end the conversation and before we organise the treatment for them. There are two things. One, progesterone is very safe for the mother. It's been used for over 50 years actually in pregnancy, sometimes more successfully than others, but it's used, for example, for women undergoing in vitro fertilization to support the pregnancy. It has been used to varying degrees of success in women with recurrent miscarriages or to prevent miscarriage. So we have a wealth of experience that progesterone is very safe for the mother. And the important thing is, if the baby survives, after the mother has taken mifepristone, the first abortion pill, is there any possibility that there'll be an increased risk of malformation for the child if the child survives? And I reassure all of the ladies that I speak to that if the baby survives, there isn't any increased risk to them of any congenital malformation or other malformation beyond what you would expect with in the normal pregnancies. That's a very important point. And again, the evidence for that is the more than 2,000 live births that have occurred in the US and in a number of other countries around the world, but particularly in the US, over the last 8 years, where there isn't any increased risk to the baby. The big risk is that the baby will not survive. So if the baby survives, he or she will be as healthy as any other normal baby in a normal pregnancy.
So connecting this then to DIY abortions, which is what we've been talking about, the fact that you've had so many women coming to you or to other doctors who help with the abortion reversal pill, looking to reverse their abortion, do you think this indicates that there is quite an uncertainty in some of these women's minds about what they're doing, considering so quickly they're changing their minds?
Yeah, it is. Again, as I said, when we started this, we had no idea how many we might expect. We read one of the papers that one of the prominent people from the US called Professor Grossman. He's very much against the idea that mifepristone can be reversed, so that abortion pill reversal is a valid medical concept. And he said, we don't really know, but he estimated between 5 to 10 per 100,000 women might change their mind. He said it's very rare that a woman will change her mind. So taking those figures on board, we suspected we might have maybe between 10 and 20 requests for help per year, looking at 210,000 abortions in the UK and 170,000, 180,000 being medical abortions. So we were surprised that we're getting basically 4 a week. So we'll have, by the end of 12 months, we'll probably have about 200 requests for help. So that suggests, and this is for a service that nobody knows about. So what tends to happen is that the girl takes, she's pregnant, she's in a crisis for whatever reason, whether it's problems with her boyfriend or husband, or parents, or peers, or job, whatever, and she decides to take the mifepristone. Very often without much counselling, particularly if she's received it over a telephone conversation or a telemedicine consultation, without any proper in-depth analysis of her background or the reason why she might be in two minds about keeping her baby in her pregnancy. And so she doesn't know what to do. She's changed her mind. She regrets what she's done. And by and large, they go into Google and they look up abortion reversal, and they get an American website who myself and Eileen are registered with the abortion website. Sorry, with the reversal website, the abortion reversal website. And they contact us if it's a lady in the UK. And then we contact them immediately and try to get them help to save their pregnancy. Once we're happy that that's what they've now decided to do. So even people who are pro-choice, if they're truly pro-choice, they would support us in this, because the woman has made a decision, but now she's made a different decision. And if it's her choice, it's her choice. So we're helping her in her choice to try and save her baby. But I suppose the important thing is that we're getting far more calls than we anticipated. And that might be related to the fact that women are now getting the abortion pill so easily. In fact, one of the girls who unfortunately lost her baby, while initially she seemed to respond to treatment, but a few weeks later the baby was no longer alive on a scan. He said that she was very grateful for the help that she received, but she said, you can't believe it's so easy for a woman to obtain these pills. And that's how she herself received it. She got it by making a telephone call without any in-depth analysis of her situation, which she then regretted. He didn't know what to do, and it was only a friend at work suggested she should go on the internet to see was there help. So unfortunately, it was more than 24 hours before we were able to get help for her, because she didn't know what to turn to. Others have said that this is a service that everybody should know about.
So this website then, Dr. Dermot, it's abortionpillreversal.com, isn't it?
I think so, yeah. There might be a www or something before. We've actually, the UK and Ireland have actually just this week have launched an Ireland and UK website in the hope that might help to expedite referrals to us, to get mothers to come to us as soon as possible once they've made their decision that they now want to save their baby.
But just to confirm that when a woman goes on to this website, even though it's an American website, they will be connected with a doctor in the UK.
Yeah, and very quickly, they will try. Once there's a nurse on the other end of the American line, and she will take the details. And once she hears United Kingdom or England or Scotland or Wales, she will contact one of us immediately and give us the details, and then we take it from there.
So when a woman phones up for a DIY abortion, obviously the consultation is usually done over the phone. Would she be told about the abortion pill reversal in case she could change her mind?
No. In fact, I had a girl today actually who had been in contact with BPAS, and one of the things she mentioned in my consultation with her, because she had a lot of questions, I said, BPAS never mentioned anything about abortion pill reversal, so I know they don't, and they're very much against it. And I think it goes against the ideology that abortion is a good thing. How could a woman possibly want to change her mind? So they're certainly not doing anything to support us in our role. In fact, we try to get support from the Royal College of Obstetricians, the Royal College of GPs, but they try to sort of wish us away by saying that there was no evidence that this was successful, but they ignored the evidence that we presented to them. They said it's not licensed, but we pointed out that misoprostol is not licensed for abortion, and yet it's used in all cases for medical abortion. And they said that the best management is expectant management. Now, we know that from studies that have been done looking at this, that expectant management means that if the woman changes her mind that she does nothing, she just doesn't take the second pill, we know that that presents a higher risk of serious complications, particularly hemorrhage and sepsis, compared to if we can get progesterone. While it doesn't always work, it will help to, or might help in some cases, to reduce the amount of bleeding, because it will help to preserve the pregnancy. Now, on the downside, it might lead by sort of not successfully retaining saving the life of the baby, it might lead to more need for surgical removal of the dead, fetus and dead baby and the other products after. So that is the one downside that we have to admit to. But if a woman is desperately trying to save her baby, then that's a price that they and us are willing to pay to get that. And they're made aware of that before we start treatment.
So just something else to ask you then, Dr. Dermot, when women are phoning up for these DIY abortions, would they be offered other options of help and alternatives? Is that commonplace, do you know?
I don't think so. And none of the girls, I've only experienced with the 50 or 51 or something that I've spoken to or been involved with. And that's certainly not something, it's basically, you want to have an abortion, we'll send you the pills. So they come in the post. They don't get a scan. So some of the girls we've had to have had scans because they've gone through very other clinical means, but those who do it by telephone don't get a scan. So the person on the other end of the phone, whether it's BPAS or Mary Stopes or whoever, can't be certain of the age of gestation. So it could be that the last they ask them when was your last menstrual period, and they'll tell them and they'll calculate, yeah, you're 8 weeks or 9 weeks or whatever. They have to be under 10 weeks to legally comply with the law on this at present. But there's no way that the person on the other end will know that that's the truth. There's no way they'll know that as I mentioned, that the person asking for making the telephone call is the person who's actually pregnant. So there is a possibility, or at least it opens the door for abuse. That, for example, if a girl is pregnant and her boyfriend doesn't want her to keep the baby, he could get a sister or another person to impersonate her, get the drugs, and then surreptitiously administer them to her somehow. And there have been cases of that, and not necessarily as a result of the lockdown in this country, but there certainly have been cases reported where that does happen. I'm concerned about the risk to minors. We know from the various reports of abuse, particularly the Rotherham report, that repeated examples came of young women, young girls under 16, who were victims of abuse, who were brought repeatedly for abortions, and no questions were asked her, how was this allowed to happen? So it would be very easy for an abuser, a trafficker, to obtain drugs online by a telephone call or online surreptitiously, and make sure that his victim is forced to undergo abortion, because it's not good for business for young girls that you're using for sex trafficking purposes to be pregnant.
So just to make it clear then, when we're talking about a DIY abortion, a woman will literally have no face-to-face consultation before or while she's taking the pills or afterwards. It's literally everything is just on the one phone call before the...
It's usually a phone call now. At best, there might be, I can't be certain, there might be some case where they might have this sort of video link, but as far as I'm aware, and the people that I've spoken to, it's a telephone call, telephone consultation. You're asked a number of questions, you're not giving in-depth counselling, and questions aren't asked much about your background. Depending on, to some extent, maybe on the counsellor or the nurse on the other end. It doesn't necessarily have to be a doctor, by the way, and that's another issue that with the Abortion Act of 1967, 2 doctors are meant to be involved, and that doesn't happen with telephone conversations or telemed prescribing. So it's just, it leaves so many avenues open to abuse. The Abortion Act in 1967, bad and all as it was, leading to the deaths of millions of unborn babies in this country, at least there were some a pretense or alleged safeguards, and those safeguards were put in good reason. The people who needed convincing at the time in 1967 were those who knew that abortion was not right, but they could be convinced because they were led to believe that if we don't do this, then women are dying because of backstreet abortion. So in a way, this is reintroducing the whole concept of backstreet abortion. So no oversight, women doing it by themselves at home, little or no medical input, no follow-up. And if something bad happens, well, sorry, call an ambulance, or it's up to you to sort it out. So that's basically what we've returned to, is the lack of supervised medical input, supervision, is worrying.
So I know some people have spoken before about how it can be difficult recruiting doctors to help in abortion services. So could this be a way, do you think, of trying to overcome that people are using, so that we no longer need the doctors or even necessarily nurses? You've just got somebody on the end of the phone.
Yeah, there is concern. I wasn't aware of it so much in this country. I know certainly in other countries they're very concerned. Some of the countries in Europe, that doctors are having a conscientious objection to participating in abortion more and more. And there certainly would be one way that could be overcome by those who are still determined to provide an abortion service. That, okay, if we can't get doctors, at least we can give out the pills, because it's much easier to send pills by packaging rather than having to see somebody face to face and discuss the issues at length. Because they try to tell us that, you know, no woman comes to make a decision about abortion easily, that it's a very difficult decision. But they're making it, they're trying to make it a very easy decision for her now with no consultation. So it could be a way that abortion providers have found that, yeah, we don't actually need to have too many doctors on board with this. And while you do, if it's someone's undergoing a surgical abortion, you do need to have a degree of expertise in carrying that out. Whereas if the pills are licensed, which they are, they're allowed to be used, not necessarily licensed as I mentioned, but if they're allowed to be used, and they can be prescribed, they can be given out by a nurse practitioner or a counsellor on the other end of the phone, and it's so much easier. And you know, there are bigger profit margins to be made. But the more you carry out, because they still get paid the same amount, whether they see them face to face or whether they send them the pills over the phone. So you're talking about big profit margins for the abortion providers, I would suspect here.
And when we're talking about DIY abortions, it's DIY as in the woman has to decide for herself how pregnant she is, because there's no scan. Somebody might help her work it out, but there's no scan to clarify that. She is administering the medication herself. She takes the pills herself. She has to dispose of the dead fetus, the dead child herself, and there's no follow-up counselling. So it's completely her that's running the whole process, isn't it? She's doing it all herself.
So I believe, obviously, if complications occur, she'll be expected again to make her own way to casualty or emergency department to sort that out. But yeah, she won't get meticulous follow-up from whoever's provided her with the pills in the first place. I think that goes without saying. It's just not possible to do that.
So from your perspective, then, would you feel there is a duty of care that's lacking here, and it's real safety concerns?
Yeah. Well, the main reason, as I mentioned earlier, abortion is bad in all circumstances, but to try to advance it further without at least the pretense of the previous safeguards that were there before, is not good for women's health. It's certainly not good for the baby's health, but it's another disregard for the health of the mother, I think, in all of these situations.
So again, and this is the message that we got back when we were talking to Dr. Eileen Reilly, was that even for somebody who does support abortion, then these DIY, these home abortions are even one step backwards, like you were saying, to backstreet abortions, that they're completely disregarding women's health, both physically and mentally. They
are, and my biggest concern, because my understanding and in relation to the DIY compared to what was there before, is that the mother had to take the first pill in the clinical setting, and so there was the other opportunity to discuss her concerns or any apprehension that she might have to undergo counselling, or to delay it a little bit longer and come back for a further consultation if she wasn't quite certain. Whereas on the telephone conversation, that's not going to happen. But more importantly, are the other concerns that I mentioned about possibly being coerced, not being certain that the person who's pregnant is actually getting the drugs, that they may be surreptitiously given to others, and how much it opens the avenue for victims of abuse to go, undetected. Which, at least if there's a face-to-face consultation, at least some of these issues can be recognised and can be addressed in a much more satisfactory fashion than is likely to happen with a simple telephone conversation.
Thanks so much, Dr. Dermot. That's really helpful. And just to remind people that this consultation needs to be responded to before the 26th of February, isn't it? So we just really want to encourage people to voice their concerns that they have for this. And just going back to what we were saying earlier, if anyone is interested in finding out more about the abortion reversal pill, it's abortionpillreversal.com is the website they need to look at to find out more about it, particularly if it's somebody who is has themselves taken the first step of the abortion process with a medical abortion and wants to look at the possibility of keeping their baby. They need to get in contact with somebody on that web page. So thanks so much, Dr. Dermot, for being with us today. Really appreciate your time. Thanks so much. God bless you.
Thank you, Isabel.